Hi, I'm Caitlin Bernhard. This session is being recorded, but I am live with you in the Q&A. And please feel free to reach out in the Q&A with any questions and I'll answer them as they come up. Enjoy the presentation. Hi, I'm Caitlin Bernhard, cannabis nurse practitioner in Western Massachusetts. And I'm the owner and CEO of Azala Wellness and co-CEO of Azala Education. Today, I'll be talking about cannabis use for migraines. So, migraine headaches are neurological diseases with varying symptoms. Most patients experience headaches lasting at least 4 hours up to multiple days. It's thought that the overactivation of the trigeminal system and inflammation in the meninges of the brain both contribute to migraine pathophysiology and pain transmission. At least 39 million Americans, or 14% of Americans, suffer from migraine headaches. And there's a $20 billion annual cost in terms of treatment, days lost at work or school, et cetera. There's thought to be a hereditary link, so migraines often run in families, and about times as many females experience migraines as males. And migraines they can be spontaneous or they can be triggered, and the triggers really vary. Common triggers include stress, foods, low blood sugar, alcohol, changes in sleep patterns, changes in barometric pressure, hormonal changes, concussions, and traumatic brain injuries. Often, patients experience unilateral or one sided throbbing pain, but the pain can be bilateral or in the front or back of the head, around the eyes, in the jaw or teeth, etc. Pain is often worse with activity, and many people also experience nausea and vomiting and different sensitivities to light, to smells, or different noises. And like I said, this can cause people to miss school, work, and social events. About 20% of migraine patients also have an aura, which can be visual changes or loss of vision or tingling, numbness, difficulty speaking, usually right before and during the migraine headache. Episodic migraines are when people have 14 or less headache days per month, and chronic migraines are when people are experiencing 15 or more headache days per month for at least 3 or 4 months. To diagnose migraines, patients usually undergo MRIs and CT scans to rule out tumors, strokes, brain bleeds, infections, and other neurological conditions. And a migraine journal can be really helpful for a diagnosis as well, where you track when you have migraines in your every month, what foods you're eating, how your sleep has been, etc. Current migraine treatments include pain relieving medications and preventive medications. Pain relieving medications include aspirin, NSAIDs like ibuprofen or naproxen, and the caffeine aspirin acetaminophen combination like Excedrin migraine, triptans, dihydroergotamine, lasmitidine, and calcitonin gene-related peptide blockers, or CGRP blockers, are some newer medications. The CGRP is a vasodilator and contributes to inflammation in meninges of the brain, both of which cause the migraine headaches. Um, there are also opioids and anti-nausea medications, which are frequently prescribed. Preventative medications include antihypertensives like propranolol, metoprolol, or calcium channel blockers for migraine with aura, antidepressants like amitriptyline, anti-seizure drugs like valproate, topiramate. Some patients get Botox injections every 12 weeks, and some patients receive the CGRP monoclonal antibody injections monthly or quarterly. All these medications do come with some side effects. The pain relieving medications, their side effects may include pain in the chest, neck, and limbs with paresthesias and sensory changes, as well as gastrointestinal, heart, and kidney side effects and sedation. The preventative medications side effects include weight gain, drowsiness, and behavioral or cognitive changes. Other migraine treatments, people look to lifestyle remedies like relaxation and mindfulness, keeping to a strict routine of sleeping and eating, hydration, keeping a migraine journal, like I mentioned before, to track what causes the migraines and have a better understanding of how to prevent them, and regular exercise. And complementary medicine like acupuncture, biofeedback, cognitive behavioral therapy can all be helpful, as well as meditation and yoga, various herbal products, and supplements like vitamin B2, magnesium, and CoQ10. Cannabis has been used to treat migraine headaches for a very long time. Some early references to using cannabis for headaches were found in manuscripts from the 6th to 7th centuries AD. Zipping forward to the 1800s, many physicians throughout Europe and North America recommended cannabis indica extracts for prevention and treatments of headaches. And this was included in the pharmacopoeias of Europe and North America. In 1915, Sir William Osler, who's considered the father of modern medicine and internal medicine, wrote that cannabis indica is probably the most satisfactory remedy for migraine headaches, and he recommended a prolonged course. And in 1941, cannabis was removed from the US Pharmacopoeia against the recommendation of the American Medical Association. The endocannabinoid system is a crucial physiological system that controls and maintains human health and homeostasis. It includes the CB1 receptors and the CB2 receptors. And the CB1 receptors are densely located throughout the brain and also found in organs and cells like nerve cells, fat cells, the adrenal gland, the heart, the lungs, colon, and the reproductive organs. CB2 receptors are highly expressed throughout the immune system, and they're thought to be important in managing and treating inflammation and immunity. There are endocannabinoids within our bodies that we create, anandamide and 2-arachidonyl glycerol, AEA and 2-AG respectively, are the most well known of our endocannabinoids. And then from the plant, we have the phytocannabinoids. Over 140 have been identified from cannabis sativa, and some other plants also have phytocannabinoids that stimulate our endocannabinoid systems. These phytocannabinoids fit into the endocannabinoid receptors, or they affect how the receptors act. An imbalance of endocannabinoids is thought to contribute to chronic illness, migraines, and autoimmune disorders. The term for this imbalance is called clinical endocannabinoid deficiency. We have a basic endocannabinoid system tone, which includes balanced levels of all endocannabinoids, as well as balanced endocannabinoid synthesis, breakdown, and cannabinoid receptor density and activity. Decreased endocannabinoid function and tone can cause decreased pain thresholds and digestive, mood, and sleep disorders. These endocannabinoid system deficiencies could be hereditary or they could be due to injury and disease. But migraines, fibromyalgia, and IBS studies have shown the best evidence for ties to CED. These are all high pain states where the diagnosis is based on symptoms and instead of signs of illness in labs or observations. These are all diagnoses of exclusion, frequently associated with anxiety and depression, and they're also frequently comorbid conditions. The endocannabinoids system, CED, and migraines all come together in an interesting way. The ECS may interact with migraines on multiple levels, including pain perception and nerve transmission, neurotransmitter release, blood vessel dilation, and inflammation. Preclinical research has shown that anandamide inhibits trigeminovascular neurons, which again contribute to migraine issues if they're overactivated. via this cannabinoid 1 receptors and also the serotonin receptors. Patients with chronic migraines have been found to have lower levels of anandamide than those without migraines. And this is associated with increased transmission of pain signals in the spinal cord. Phytocannabinoids like THC, CBD, and others are anticonvulsants. They have analgesic properties. They're anti nausea or anti emetics, and also anti inflammatory. And these are all different pathways that can be used to treat migraines and associated symptoms. It has been found for many that lower doses of THC can treat migraine pain more effectively than higher doses. This may be due to the overexcitability of migraine patients' neurons. And many patients do combine THC and CBD together, which decreases THC side effects and gradually self titrate to higher doses as needed for best effects or best treatments for migraine headaches. CB1 receptors and CB2 receptors could both be potential targets for migraine treatment. CB1 receptors block both peripheral and central pain transmission pathways and decrease neuron excitability that's associated with migraines. CB2 receptors manage inflammation, and so they could be targets for anti inflammatory actions. Anandamide is produced during inflammatory conditions. It is broken down by the enzyme fatty acid amide hydrolase, or FA enzyme. This could be another therapeutic target for migraine pain. If you could inhibit FA, which would slow the breakdown of the anandamide, you could adjust the anandamide levels throughout the nervous system. In a survey of over 1,400 medical cannabis patients, over 35% stated that they use cannabis for migraines or headaches, and 81.4% of the respondents preferred inhalation as a method of consumption. In a separate survey of 145 medical cannabis patients, they found interesting results about decrease in migraine frequency over time. 61% reported a 50% or more decrease in monthly migraine frequencies. The average monthly migraines were reduced from 10.5 to 4.6 per month. With these patients, they preferred inhalation for acute symptom management, and they used a combination of inhaled and oral methods of consumption daily. And I see this frequently in the patients that I work with, where when I check in with them a year after they initiate cannabis use for migraines, some of them have not even had a migraine in 6 months or more. My patients are telling me that they use cannabis, various methods of consumption for cannabis. They're smoking or vaping for acute pain management. They're using sublinguals like tinctures, lozenges, or films if they're trying to avoid smoking or not in a place where they can use inhalation. Edibles if they really just want to go and lie down and sleep until the migraine has passed. And topicals for to apply to their foreheads, temples, around their ears, jaw, and back of their neck, and getting some really good results with that as well. So that concludes my information about cannabis and migraines for today. I'd love to answer any questions that you have. Thank you so much for attending.